Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Doxycycline. Its brand name is Adoxa. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how doxycycline works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe doxycycline. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does doxycycline work? Well, first of all, doxycycline is an antibiotic agent and a tetracycline derivative. It inhibits protein synthesis by binding with the 30S and possibly 50S subunits of susceptible bacteria. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in malaria prophylaxis. We may see it used to treat a respiratory tract infection, or as an add-on therapy in severe acne. We may see it used to treat sexually transmitted infections, and there are also some other indications. With respect to contraindications or reasons we would not be able to prescribe doxycycline, we just wouldn't give this medication to a patient who had a hypersensitivity to doxycycline, other tetracyclines, or any other component of the formulation. Note about dosing with doxycycline. So in the treatment of moderate to severe inflammatory acne, we may see 50 to 100 milligrams twice daily or 100 milligrams once daily. In the prophylaxis of malaria, we may see 100 milligrams daily, and they would begin this treatment 1 to 2 days prior to travel to the endemic area, continue daily during travel, and for 4 weeks after leaving the endemic area. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using doxycycline, so we'll go over some of those here now. 3% of patients may experience hypertension or high blood pressure, while 2% may experience anxiety. Pain seems to happen 2% of the time. Increased serum glucose may happen 1% of the time, and 5% of patients may experience diarrhea. 2% may experience abdominal pain, and 1% may experience abdominal distension. A fungal infection may happen 2% of the time, and influenza may occur 2% of the time as well. 1% of patients may experience back pain, and 5% may experience nasopharyngitis. 3% may experience sinusitis, and nasal congestion may happen 2% of the time. A sinus headache may happen 1% of the time. Now, a more rare but serious side effect would be an esophageal ulcer. That's all we're going to talk about today with doxycycline or Adoxa. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.